Do people mind just turning their microphones off? Because I'm getting a bit of feedback through people's speakers is the only thing. Okay. Bear with me. Okay, can everybody see that? Guessing that's a yes. Okay, so thank you, Mariel, for the introduction and for organising the event for Antibiotic Awareness Week, and to everyone who's joined us this evening. I've already been introduced, but yeah, I'm a member of the Welsh AMR Delivery Group, and I also represent the British Veterinary Association on that panel as well. So the learning objectives for today are, for those of you who don't already know, learn what antimicrobial, or more specifically antibiotic resistance is. How is it that organisms develop resistance to certain drugs or chemicals? Why is it important? How does it affect us and our animals on an individual level, but also on a global scale? And on that note, we'll talk about a One Health approach to tackling antibiotic resistance and why all of us, not just scientists, vets and doctors, have got a role to play. We'll finally discuss what that role is and how, as animal owners, we can help make a difference by understanding how resistance develops. It does make it easier for us to identify the steps we can take to tackle AMR. So antimicrobial resistance is the ability of a microorganism to stop a drug from working against it. It covers a range of drugs against different organisms, including viruses, parasites, and bacteria. But for the purpose of this webinar, we're going to be looking specifically at antibiotics. You might catch me using antimicrobial and antibiotics interchangeably, but this is focusing on antibiotics. It's essentially the same process that we see in horse wormers. Some of you may have already had experience with wormer resistance on your yard, and it's a similar process in the development of AMR. So a quick science lesson for those of you who don't know how antibiotic resistance occurs. It's essentially survival of the fittest. So an organism that's best adapted to its environment will survive, reproduce, and pass on their genes. So in the case of antibiotic resistance, the environment is the antibiotic. Some bacteria have got a natural inbuilt resistance to the antibiotic. They survive and reproduce, passing on their resistant genes to the next generation. Then over time, more and more bacteria carry that resistant gene and the drug becomes ineffective. And that bacteria is now considered to be resistant to that particular drug. The slightly scary thing about bacteria is that they don't only need to reproduce to pass on their genes, they also have the ability to snip out sections of their DNA containing that resistant gene and pass that directly onto other types of bacteria. So those bugs can then carry resistance to a drug even if they've never been in contact with it. Over time, we need higher and higher concentrations of the antibiotic to get the same effect or kill rate of bacteria. That's why sometimes the dose that your vet prescribes might vary slightly from the dose on the antibiotic packet. Sadly, the development of resistance sort of outstrips and outpaces the licensing laws for different drugs. So please make sure that you follow the dosage instructions given to you by your vet or your GP, as they are generally in line with the most up-to-date research, whereas the label on the drugs may not be. Eventually, sadly, no amount of drug is effective against the bacteria. Once that occurs and resistance is developed, it cannot be undone. So there are two Petri dishes on the screen there. On the left are small discs of antibiotic. The bacteria are sort of the hazy yellowish area around it. And you can see those discs of antibiotics have stopped the bacteria growing in those areas around it. Whereas the Petri dish on the right, there are bacteria growing right up to those antibiotic discs in certain areas, and that's because they are no longer susceptible to the effects of that antibiotic. So sadly, the development of resistance is inevitable. Survival of the fittest is always occurring, and nature is always going to outsmart us. Penicillin became widely available around the time of World War II, and the first superbug, MRSA, was identified less than 20 years later. So it can happen at quite a rate of knots as well. What it means in reality is that over time, we're no longer able to treat infections, and diseases that were once easy to cure can become life-threatening. We've got to remember that antibiotics are not simply drugs that make us feel better more quickly. They are life-saving. There's a reason that the average life expectancy used to be around 47. It's been estimated that it may be around 50 in a post-antibiotic era. It's also important, drugs companies are no longer researching new antibiotics. There have been no new classes of antibiotics developed since the 1970s, so we've got to preserve the ones that we've got. Those of us with animals have got an additional responsibility. Superbugs such as MRSA don't only affect humans. We see increasing cases in dogs and horses, particularly in hospitals as well, which is concerning. But in addition to those, there are a number of infectious diseases that can be spread between animals and humans. So that includes bacterial infections like salmonella, tuberculosis, but it's not only the bacteria and the diseases themselves, it's also their resistant genes. So it's important for anyone that works or owns with animals to help break that cycle of resistance spreading from animals to humans. So as well as tackling antibiotic resistance and using antibiotics responsibly, biosecurity and hygiene also has a really important role in breaking that link. So it's because of that we need a One Health approach. So it's not enough to just tackle antibiotic resistance in humans. We've got to look at it across all species to try and preserve antibiotics for the treatment of life-threatening infections in both humans and in animals. So as I've said, we can't stop resistance developing, but we can slow it down. Every time we use an antibiotic, we fast forward that cycle of natural selection. So the overuse and misuse of antibiotics promotes the development of resistance. Every time we use an antibiotic, we've got to weigh up whether the benefit of using the drug outweighs the risk of resistance. It's no longer acceptable just to prescribe antibiotics just in case. Animals have got an immune system. So the question that we probably should be asking, is a young, fit racehorse with a mild respiratory virus likely to develop a secondary bacterial pneumonia? Probably not. We could well do with just monitoring that closely over the first few days and see how things progress. So all of us have got a role to play, the people prescribing the drugs, so your vets, doctors and pharmacists. We have a huge amount of sort of CPD and training regularly to make sure that we are prescribing responsibly. Various veterinary organisations provide a lot of guidance to us to help us select the right drug for the right bug and prescribe those antibiotics at the correct dosages for the correct conditions. Drugs companies may no longer be researching antibiotics, but they are looking into other ways of dealing with infectious diseases, and some of those are showing quite exciting options really for the treatment of infectious diseases. Animal owners and keepers as well. Your role really is to follow the guidance of your vet when using antibiotics, but also to focus on preventative health care, try and bolster your animal's immune systems and look at good hygiene and biosecurity to try and minimise the spread of diseases. So, case in point, really, a horse with a snotty nose. There are a number of things that it could possibly be. It could be a virus, in which case antibiotics aren't going to be effective anyway. It could be non-infectious. It could be something like equine asthma. Again, antibiotics aren't going to work there. Other forms of diseases in horses, sinus disease, dental disease, can also cause a nasal discharge. And unless you get to the bottom of those problems, antibiotics aren't going to form a permanent resolution there. So that really highlights the importance actually of getting on board with your vet, looking into options for further diagnostics and testing to try and get an accurate diagnosis before we look at treatment. Not only does that help preserve antibiotics for those circumstances where they're actually going to be of benefit, it's probably likely to save you some money long term as well. We should look at other options as well. Systemic usage of antibiotics in horses is not without risk. Any drug has adverse effects. Horses are particularly susceptible to antibiotic-induced diarrhea, and that can be life-threatening due to the huge amounts of liquid that horses lose in their feces. So we have, as well as the global issues with regards to resistance to consider, we've got to, as vets and horse owners, think about the risk to that individual animal as well. I've already mentioned, sort of upping the amount of testing that we do to determine what the actual underlying cause of the condition is. Are antibiotics actually required? Think about other delivery methods. So for wounds, for example, implementing appropriate first aid in a timely manner may well reduce or eliminate the need for antibiotics down the line, or we could look at topical delivery methods, so using antibiotic ointments, for example, directly on the skin. Some of your vets may give you these. I think it's important to remember that antibiotics are not always the answer. Horses have got an immune system. If the condition isn't life-threatening, should we be using a life-saving drug? There are other conditions as well where the use of antibiotics is actually contraindicated. Foot abscesses. Most of you who've owned horses for a number of years have probably dealt with one of these at some point. Giving antibiotics can actually stop those abscesses coming to a head and just prolongs the discomfort for your horse ultimately. Conditions such as diarrhea or strangles, antibiotics are actually contraindicated, as it can prolong the course of disease again in those cases. So what can you do as an owner? I think it is important to remember that any animal that's got a strong immune system is going to be better able to fight off infections. Vaccinations, you can vaccinate against a number of bacterial diseases themselves, so things like tetanus, there's a vaccine for that. Also, the use of vaccines for respiratory viruses such as flu vaccines, that's going to prevent certainly older horses that may have poorer immune systems being struck down with severe viral disease and putting them at risk of secondary bacterial pneumonia. So anything that we can do to try and bolster our animals' immune systems is important. Foals, any of you who breed horses or have got livestock will know the importance of colostrum in passing on immunity from the mare to foals. And that's one of the first critical things that we can do actually is get that colostrum into the foals in a timely manner and bolster their immune system that way. The other important thing is any other condition that's going to lower a horse's immunity. So Cushing's disease, many of you will have heard of. The effects of that can be immunosuppression. And some of the horses with Cushing's actually, rather than sort of the typical curly coat, just present in the first instance with recurrent infections. So the foot abscesses that just never seem to go away. And that's ultimately because their immune system isn't quite as good as it could be. So getting on top of those conditions will all help. Please try and avoid treating the horse yourself. Vets aren't cheap. We all know that. I think that's another discussion for another time. But ultimately, it's not uncommon for us to go on yard and find sort of leftover antibiotics from a previous occasion, or to arrive to a wound that's maybe been present for a couple of weeks, might not have needed antibiotics initially, could have been stitched or given a shorter course, and they've already been administered. So please try and avoid doing that, partly because different antibiotics are needed for different conditions. So the antibiotic sachet that you've got might not actually be might not be appropriate, for that condition that you're looking to treat. You might need to give a different dose. Starting certain antibiotics can also limit our ability to prescribe other drugs, mainly because of the way that different antibiotics work. They can have a sort of interaction and reduce the effectiveness of antibiotics that are prescribed subsequently. Also, the more types of antibiotic that we use. So say if a horse has been given an antibiotic that isn't the right one, if we then go on and give them the correct one, using multiple different types of antibiotic increases the risk of that horse developing a fatal colitis. So we must remember that it's not without risk. The drugs might be out of date. They might also be contaminated. Again, it's not uncommon that there's been sort of that bottle of penicillin that's maybe been left open for a while, and it's really tempting to just give a quick jab of that just in case. But, you know, if it's been contaminated with bacteria itself, the antibiotic in the bottle has probably gone towards fighting off those bacteria rather than actually being effective when it gets to the horse. Passport legislation as well. Horses in the UK are still considered food-producing animals, and many of the antibiotics that we use must be documented in the horse's passport. Feel free to give us a ring as well. Most vets are more than happy to offer initial telephone advice. Certainly during the COVID pandemic, we've all got pretty used to the concept of telemedicine. So certainly for things like wounds, sending in photos as soon as they occur can help us give you the most appropriate advice in how to either manage them yourselves at home or advise whether a visit might actually be needed. So don't be afraid to call us. A lot of vets will do this free of charge. So yeah, just pick up the phone and let us know if there's anything that you're unsure about. We'd much rather give you advice in the first instance than end up sort of dealing with a bigger problem 2-3 weeks down the line. Follow dosage instructions and complete the course. That'll be similar to information that you've all probably had from your GPs at one point or another. Even if the condition's improved and the clinical signs have gone away, make sure that you do finish the course. Hygiene and biosecurity, so both to prevent the spread of infection between horses. If you've got something that is bacterial and can potentially spread between them, it's certainly much better to be treating one horse that's been isolated than having to treat a whole yard of them. The use of sort of frequent hand washing not only helps prevent the spread of diseases, but also the resistant bacteria. It's also, I've put properties there as well. It's also important to remember that we can transfer diseases between different properties as well. So disinfecting hands between going to other yards. Certainly if you care for other people's horses and then go home and do your own, maybe consider the use of, you know, separate overalls and boots to do that. So sorry, I have a tendency to speak quite quickly, so I apologise if I've rushed through all of that. I've had a really good question actually handed in by somebody prior to the webinar. I'll just take the presentation down now and see if anybody else has said anything, but thank you. Okay.
Thank you, Amelia. Thanks for that.
That's okay.
Very informative, fair play. But yeah,
that's all right.
Let's go to the questions.
Yeah, so I can't see that anyone's asked anything in the chat, but we had one question. It was sort of sent in 3 parts, so I'll address each 3 parts individually. So the first question was, can horses develop sepsis? In short, they can, yes. The nomenclature is slightly different. We tend to cause it sort of endotoxemia in horses, and that eventually results in multiple organ failure and death. The question was, has there been an increase? I personally don't think that, I don't know, and I don't think that data is available. I think it would be quite difficult to collate the information. You'd need to look at sort of a number of referral hospitals that tend to see these patients. But also it is likely that a number of horses that do develop sepsis are put to sleep before they get to that stage. So I think actually getting accurate information on that would be difficult. The question of whether we would or have seen an increase in sepsis related to the development of resistance in antibiotics, I think it's absolutely a possibility if we lose the ability to treat bacterial infections with antibiotics. I think the important thing to remember, though, is that most cases of septicemia in horses actually are seen in foals, and that tends to be foals that have got failure of passive transfer, so haven't had that normal colostral immunity, and it tends to be normal bacteria that live in the environment that become pathogenic or become infectious and cause a problem only when there is a lack of normal immunity. So that's in foals. In adult horses, most of the cases of septicemia that we see are secondary to bowel disease, so things like colic, where the gut wall becomes damaged, and that again allows normal bacteria that typically don't cause a problem to pass across the leaky gut barrier and into the horse's bloodstream, and that causes the signs of septicemia. So it tends not to be an inability to treat infections that causes septicemia in horses. It tends to be more an issue with immunity or the presence of other disease that causes them then to develop it. Another typical cause would be retained fetal membranes in mares, that can then cause metritis, so an infection of the uterus, and they get septicemia from that. So I think, if anything, it's rather than highlighting the potential link between antibiotic resistance and an increased prevalence of septicemia, I think it more highlights the need for good preventative medicine. So getting that colostrum into your foals, making sure that things like retained placenta in horses are dealt with promptly, and again that any colic cases are seen by your vet as soon as possible, really. So that's the first part of the question. The second part is there an overuse of antibiotics due to a lack of management of minor to moderate skin breaks? And does the environment affect the efficacy of basic wound care? I think there possibly is an over-reliance on antibiotics in the management of wounds in horses, but I think the important things to consider are that, unlike human wounds that are often, might just be by a relatively clean kitchen knife, pretty much all of the wounds that we see in horses are quite heavily contaminated, and often there's been a delay between the wound occurring and when we actually can intervene. If we have a cut ourselves, we can deal with it straight away. That horse might have been stood around in the field for the best part of 12 hours before it's checked on. So a lot of those wounds have actually got active infection by the time they're even dealt with. Things that we can do is, as soon as you see a wound, sort of try and thoroughly clean it as much as you can. The solution to pollution is dilution. So even just getting a hose pipe on a heavily contaminated wound in the first instance is going to really reduce that bacterial load and reduce the need for antibiotics, or potentially give us other options such as topical use at a later stage. I think the other thing is, as well, is horses are particularly prone to cellulitis, so infection of the soft tissues after a break in the skin. They're also very susceptible to tetanus, and even very superficial wounds. Once they become populated by bacteria, they can still allow the tetanus bacteria to grow. So it's another reason to ensure your vaccinations are up to date, but that might also account for the possible discrepancy between the use of antibiotics in wound management in horses and in humans. Do I think resistance is caused by antibiotic administration not being undertaken correctly? I think no and yes. I think, as I discussed in the webinar, the development of resistance is inevitable, and many factors contribute to the acceleration of AMR. I think most horse owners, actually, for the part, are really quite responsible. Everybody cares about the horses a lot. They give the drugs as prescribed. There are obviously sort of occasional issues with palatability and horses not wanting to take certain medication, but I think, in my experience, most people are actually pretty good. I think they generally seek prompt veterinary advice and follow the prescribing guidance that we give to them. Do I occasionally turn up on yard to and decide to prescribe drugs, and somebody walks out of the tack room waving something at me saying, "Oh, I've got these left over from last time"? Yes, that does happen. If that could be avoided in the future, that would be great. But on the whole, I think horse owners in particular are generally quite good. I don't know if anyone's got any further questions there.
No further questions? No, I think there isn't. So thank you very much, Amelia. You answered those questions in detail, so thank you very much for that.
That's fine. I mean, if anyone's got any at a later date, if they want to pass them on to you, Mariel, then you can forward them on. That's not a problem.
Yeah. Okay. Thank you very much, and thank you all for attending this evening. We will also be having equine health clinics launched soon, and they will be through your local vet. That's an opportunity to receive advice on biosecurity on your yard, advice on health planning, and also, if necessary, it involves covering the costs of culture and sensitivity testing to check out to see whether bacteria is present in the ill horse, and if so, what bacteria is present and how to treat that correctly. We will be launching them soon, so you'll find more information on social media and our website whenever they're launched. So thank you very much for attending this evening, and I hope to see you again soon. Diolch yn fawr iawn. Thank you. Diolch.
Bye.